Welcome to Case Study Series in Operations Management Case Study by Skilled MBA. In 2020, Albuquerque faced significant public pressure due to protests. Mayor Tim Keller responded with a vision for public safety transformation. This led to the creation of the Albuquerque Community Safety Department, an innovative model focusing on nonviolent crisis intervention. The department's design and stakeholder alignment were crucial in addressing community needs effectively. Albuquerque's transformation was driven by a confluence of factors. The 2020 protests for racial justice heightened scrutiny on police conduct, with a federal consent decree looming. Historical excessive force allegations eroded public trust, while community advocates demanded systemic reform. This critical juncture necessitated a departure from the status quo, prompting innovative solutions in public safety management. In 2020, nationwide protests for racial justice heightened scrutiny on police conduct, with Albuquerque facing a federal consent decree. Historical patterns of excessive force and diminishing public trust in traditional policing fueled calls for systemic reform. Community advocates demanded change, marking a critical inflection point where maintaining the status quo was untenable. Leadership faced ethical tensions, balancing public safety with justice and accountability. Navigating stakeholder complexity involved addressing competing interests of police, activists, and residents. Time pressure demanded immediate action while ensuring sustainable solutions. The innovation imperative required creating new models with limited precedent, challenging leaders to redefine approaches to public safety. Mayor Keller recognized the limitations of traditional policing in addressing complex social issues. His visionary response emphasized a compassionate, civilian-first model for public safety. This approach redefined the role of law enforcement, focusing on transformative change rather than incremental reforms, setting the stage for innovative solutions in community safety. The Albuquerque Community Safety Department introduces a groundbreaking civilian response model. Trained professionals, not armed officers, address nonviolent situations, focusing on mental health crises, homelessness, addiction, and youth interventions. This approach complements police efforts, ensuring a collaborative, not competitive public safety strategy. The operational design features a three-branch response system. 911 operators are trained to triage calls, directing them to the appropriate responders. Specialized dispatch involves deploying mental health professionals, social workers, or community specialists. Intervention includes on-scene support and connecting individuals to long-term services, ensuring clear workflows for diverse community needs. Implementing the new response system faced structural challenges like establishing a department amid a pandemic, defining agency boundaries, and recruiting specialists. Cultural resistance included skepticism from police unions, public concerns about civilian responders, and institutional inertia. Overcoming these barriers was crucial for effective operational transformation. Designing the organizational structure involved establishing new reporting lines, job descriptions, and operational protocols. Training programs were developed with a customized curriculum focusing on crisis intervention, de-escalation, and community knowledge. Inter-agency coordination required clear communication channels with police, fire, and social services. Technology integration, adapted dispatch systems, and data-sharing platforms for multi-agency use. The stakeholder management strategy involved framing ACS as a means to reduce police burden on nonviolent calls. Community advocates were engaged in program design and oversight. City Council received regular briefings and transparent budget justifications. Healthcare partners collaborated on protocols for mental health and addiction cases, ensuring alignment with the shared vision. Within 18 months of ACS implementation, significant improvements were observed. Thousands of calls, previously managed by police, were effectively handled by ACS, showcasing a reduction in police workload and improved community relations. Key metrics indicated enhanced response efficiency and better outcomes for individuals in crisis, highlighting the program's success in addressing nonviolent incidents. The ACS model transformed crisis response by replacing police intervention with mental health specialists. Previously, a schizophrenic episode often led to escalation and arrest. Now, specialists de-escalate situations, offer immediate support, and connect individuals to ongoing treatment and housing, ensuring comprehensive care and reducing unnecessary hospitalizations. Mayor Keller's leadership during crises highlights using pressure points to reimagine systems, not just patch them. Inclusive design involves critics to enhance legitimacy and outcomes. Data-driven iteration focuses on clear metrics and adapting models based on feedback, ensuring continuous improvement and relevance. Operational innovation prioritizes human needs over institutional convenience. Crises expose structural weaknesses, offering chances for systemic reform. The Albuquerque case exemplifies how operations management can drive social innovation and public sector transformation, emphasizing people-first approaches, process innovation, stakeholder alignment, and systemic transformation. Thank you, and the Albuquerque case study highlights the transformative power of operations management in public safety. By prioritizing human needs and leveraging systemic transformation, Albuquerque redefined its approach to public safety. This case exemplifies how strategic alignment and process innovation can drive meaningful change in public sector operations, offering valuable insights for operations managers seeking to implement similar reforms.